Well, folks, more bad news on the Alberta COVID-19 pandemic front. We learned yesterday that Alberta had another bad day, over 1,700 new cases of infection. And then there's all sorts of stories leaking out now about how the Alberta health system is in big trouble, having to conserve oxygen. They haven't got enough oxygen for the ICU patients, and on and on. So we're going to talk to the NDP Official Opposition health critic, David Shepherd, about this. And they have recently gotten a hold of the Alberta Health Service's model, and it's very enlightening. So welcome to the interview, David.
Thanks for having me, Markham.
Look, let's start with the modeling, because my understanding is that the reality is actually worse than the worst case scenario in the modeling. And the thing that really stands out is the pressure on the ICU, the ICU units.
Absolutely, Markham. Doctors, frontline healthcare professionals have been warning about this for weeks, if not months. Unfortunately, what we've seen is a lack of concrete action by Jason Kenney and the UCP. It seems a lack of preparation. Indeed, with some of the remarks we've seen from members of cabinet, almost as a suggestion that this was their intent. So we'll see how far we can push our hospital capacity, and we'll see if that's a bit of a buffer. And maybe if that gets too intense, then we'll take further action. And that has led to what we're seeing now, where we are seeing photos going out on social media of them getting ready to double bunk in ICU rooms, so putting 2 or more beds in a space where only 1 should be, where we are hearing from more and more physicians and frontline healthcare staff about a lack of space, a lack of staffing, and the incredible pressure that they feel they're under. And unfortunately, because we know that it is a 7 to 10 day window on COVID cases, that we know that things are going to get worse. So we're not at the peak yet. And unfortunately, what we saw from the Premier last week, that sort of grab bag of half measures, sort of half-heartedly delivered, are unlikely to bring that curve down.
Yeah, that's a real problem. I've been interviewing Alberta doctors, including a number that work in emergency rooms, and they're very, very concerned about this. I mean, they're already stretched thin and exhausted. All the staff is. And over the past week, Alberta has had the highest rate of infection in Canada, an astonishingly bad rate. And one of the measures that we use to measure that is the R value. Can you explain what that is and where Alberta's R value is today?
So basically, the R value represents the number of people that a person who is infected with COVID-19 is likely to also infect. So unfortunately, we have the R value in Alberta has steadily continued to climb. The Premier last week said that, he wanted to see Alberta get down to an R value of 1. So that means that person is not spreading in the community. Unfortunately, we see those numbers continue to rise, and we see that COVID cases continue to rise. And again, we are not seeing the kind of leadership that we would need to see at a provincial level, either in terms of, showing how serious the Premier and our government takes this, or in taking the kind of actions that are needed to bring that R value down and slow the spread.
Yeah, and one of the failures, I mean, there are many. We haven't got enough time in this interview to talk about the apparent failures in Alberta pandemic management policy. But one of them is the contact tracing program seems to have simply collapsed. And I noticed on the data that today that we literally don't know where 80% of these infections are coming from. And if you don't know where they're occurring, then it's very difficult to put resources in place to bring them down and, to remedy that. Have I got that right?
Absolutely, Markham. That's one of the biggest failures that we've had from the government so far. And it is makes it incredibly difficult to bring this under control. When we don't know where 80% of cases are coming from, targeted measures don't help. We have no way to know where to aim, where to target, what activities to reduce. And indeed, so that R value then is likely to continue to rise because we have people going out and they're spreading and we don't know where. So that's creating that incredible pressure that we're seeing on our system, on the staff, on the infrastructure itself, whether that be rooms, spaces, and all of the other parts that are essential to maintain that system, which affects not only then those COVID patients, but anyone else, someone who's been in a car accident, somebody who has a pregnancy that goes badly, a delivery that goes badly, all those folks who need to access those services now are facing a crunch.
Yeah, I interviewed Dr. Noel Grisdale, sorry. He's a family doc in Turner Valley, Black Diamond, just south of Calgary. And he said his argument was, look, the Alberta system is set up on a hub and spoke. So the hubs are the big cities, and particularly Calgary and Edmonton, where all of the, the specialty services are, the really important ICU services if you've got somebody who's in critical condition. He said, normally what we would do here is we would get them to the patient to the point where we can transport them in. But he says, now, I don't know that we're going to be able to do that. And we're going to somehow, out in these smaller communities, we're going to have to be dealing with, and these patients are not going to be getting the quality of care that they deserve. They won't be getting the same quality of care that patients in the bigger cities will. That doesn't seem fair.
No, and we know that's an incredible challenge, and indeed as pressures rise, and we hear doctors like Dr. Noel Gibney just today, CBC article talking about, this is getting bad. It's like they're preparing for war. They're preparing for a disaster, because we know that, again, we have not hit the peak of this wave. And you're right, in rural areas then, that creates incredible pressure. And then for those rural patients, at some point, if they cannot be taken care of in their community, they are being sent into the city. And we are seeing the rise in rural areas, in Acadia County, in Ponoka County, in Banff. Per capita, Banff and Acadia County are leading the province of Alberta. Per capita, higher numbers than Edmonton and Calgary. So as the rural pressure builds, it puts more pressure on the urban centers. And so again, yeah, we are facing a real crisis.
Final question, David, and that is around personnel, because the doctors and nurses and support staff have been locked in this battle with the provincial government for the better part of a year now, so that's on top of them already being stressed after 10 months of being on the pandemic. And the doctors I interview say they are utterly exhausted, and now we're even going to be asking more of them, and not any number of them have actually been sick with COVID. What are you being told, by healthcare personnel, healthcare workers, about how bad this situation is?
The first thing I'd say, Markham, is what I hear from them is how dedicated they are to the work and how focused they are, and the fact that they are still, regardless of circumstances, going to put their all into saving the lives and protecting the health of Albertans. And I admire that incredible level of commitment. But indeed, as you were saying, they are exhausted already. They are beginning to feel that pressure. As you say, we already have situations where frontline healthcare professionals are having to isolate because they've been exposed to COVID-19, so they're running shorthanded. We have doctors that aren't able to be there. We have nurses and support staff that are not able to be there. And let's be clear, when we talk about ICU bed capacity, we are talking about physical beds, but those beds mean nothing without the actual staff and personnel to staff them. And we are moving now into triage mode. We're moving into as the pressure mounts in the ICU, that means then they have to start to provide lower quality of care. They have to bring in doctors and other professionals who do not normally work in ICU in critical care. And the folks that have the expertise are spread much thinner, having to supervise a larger number of patients. That pressure is building, and it is wearing them down. We have not hit the peak of this yet. We know it's going to get worse. And as you say, it's incredibly unfortunate that what we see then is that we have a government that on one hand is mouthing words about how they support workers, but on the other hand, is taking swipes at them in the fiscal update about how they don't contribute enough to our economy. They're continuing their war on doctors. They're continuing to let 11,000 healthcare workers and frontline healthcare workers in the province have their jobs dangled over their heads in the midst of this. So absolutely, the pressure is building.
David, thank you very much for this. We're going to be watching this with intense interest over the next, few days to a week, because it looks like the crest is coming. The tsunami is on its way, and Albertans, I don't think, know just how bad it looks like it will be.
I agree, Markham. So thanks for this chance to talk about it. I encourage all Albertans, take all the steps you can to help curb the spread. Wear a mask, keep your cohort small, and write to your MLAs, to the Premier. Let them know you want to see more action.
David, thank you very much.
Thank you, Markham.